Welcome to The Explainer. Today, we're cracking open the case file on a revolutionary blood test that completely changed the game for diagnosing rheumatoid arthritis.
For millions of people, these kinds of questions are the very beginning of a long and often really frustrating journey to get a clear answer. Rheumatoid arthritis, or RA, can be incredibly tough to pin down, especially when it's just starting out.
And you have to understand, for the longest time, the main tool doctors had in their toolbox was a blood test that was, well, frankly, pretty unreliable. It created this huge diagnostic headache for everyone involved, leaving both patients and doctors in this state of uncertainty.
So on one side, you've got the old guard, rheumatoid factor, or RF. The big problem with RF is that it's not very specific. It can pop up in other autoimmune diseases, during infections, and, hey, even in perfectly healthy people. But then, on the other side, you have the modern test for something called Anti-CCP Antibodies. This was a total game changer. It is incredibly specific for RA, and get this, it can actually show up in your blood up to a decade before you even feel the first twinge of a symptom. Just amazing.
Okay, so let's really get into this. To understand just how big a deal this new test is, we've actually got to go back in time. The whole story really starts with a medical mystery that took more than 30 years to finally solve. It all starts way back in 1964. Researchers in the Netherlands find this really specific antibody in RA patients they call anti-paranuclear factor. They knew it was a huge clue, but they had no idea what it was actually attacking. Fast forward to 1979, and another antibody is found. Turns out, it was the same thing, but the target? Still a complete mystery until 1998, when a team finally had that aha moment, which eventually led to the test being officially adopted in 2010.
So the big question on everyone's mind was, what on earth were these antibodies going after? And here's the kicker. They weren't reacting to any normal protein that our body is supposed to make. They were targeting something else entirely, something that for all intents and purposes shouldn't have been there. Researchers were stumped.
And that big aha moment finally came in 1998, also from a team of scientists in the Netherlands. They figured out that the answer wasn't some new undiscovered protein. No, the answer was a chemical change, a modification to a protein that was already there.
They discovered this process, and it's called citrullination. Okay, so basically an enzyme comes along and it swaps out one of our common protein building blocks, an amino acid called arginine, for a different one called citrulline. It seems like a tiny change, but this one little swap completely alters the protein's shape. And to your immune system, this new, weirdly shaped protein suddenly looks like a dangerous invader, which triggers the attack.
And this visual illustrates that whole process perfectly. Something, maybe an infection or inflammation, triggers proteins to get citrullinated. The immune system flags them as enemies. It sends out the troops, the T cells and B cells, which start churning out these specific antibodies. And that leads to the chronic joint inflammation that is the hallmark of rheumatoid arthritis.
So all of that incredible science, that whole decades-long mystery, it led directly to the modern anti-CCP test. And CCP just stands for cyclic citriallated peptide, which is the lab-made version of that protein target they use to fish these antibodies out of your blood.
At its core, this test is like a highly specialized detective. It's designed for one mission and one mission only, to hunt down those very specific autoantibodies that are the true signature of RA. And that's what makes it so much more precise than anything that came before it.
Right, so if you've ever had this test, or might in the future, you're probably wondering, okay, so what do my results actually mean? Well, the key is that it's usually interpreted right alongside that older rheumatoid factor test to get the clearest possible picture.
Now check this out, because this is how the two tests kind of talk to each other. If both your CCP and your RF come back positive, well, an RA diagnosis is extremely likely. But if only your CCP is positive, that could mean you're in the very early days of RA or that you have a high risk of it developing down the road. And if both are negative, that tells your doctor they should probably start looking for other causes for your symptoms. But here's where the story gets even more interesting. The power of this anti-CCP test goes way beyond just a yes or no diagnosis. It almost acts like a crystal ball, giving doctors a glimpse into how the disease might behave over time.
And that's why you'll hear rheumatologists say things just like this. A positive result is taken very, very seriously. It's not just a marker that you have the disease, it's a powerful predictor that you might have a more aggressive form of it.
So what does being high risk really mean? Well, a positive CCP test tells a doctor that a patient is much more likely to suffer from serious joint destruction. They're also at a higher risk for complications outside the joints, things like lung disease. Knowing this allows doctors to be proactive, to get ahead of the disease and start aggressive treatment early, hopefully preventing that damage before it can even start.
But, like any great scientific leap, this one didn't just answer questions, it also opened up a whole new set of them. And we're learning that there's even more complexity to this disease, especially for patients who don't fit that classic profile.
And that brings us to this really tough puzzle known as seronegative RA. These are patients who have all the classic signs and symptoms, the painful, swollen joints, but their blood work for both RF and CCP comes back completely negative. It's a real clinical challenge.
And here's where the story takes another fascinating twist. Some brand new research is starting to suggest that not all of these so-called attack antibodies are actually bad guys. Our immune system, it turns out, is full of checks and balances we're only just beginning to understand.
And that leaves us with this final, really provocative question. What if some of these autoantibodies aren't part of the problem at all? What if some of them are actually part of the solution, maybe even trying to protect us? It's a powerful reminder that the mystery of rheumatoid arthritis is still far from solved.